Describing what we give our patients after surgery, I use the phrase permanent fixed temporary implant bridge. And the reason I use that is because there's some centers where patients just get their teeth out and they give them dentures. And the patients are lucky if they even get implants at that place. At the same time, they are not doing what we call immediate loading. So immediate loading is where we place an implant same day, and guess what? We actually we screw on a implant bridge. That is what we consider immediate loading. There are places out there that do not provide immediate loading at all. And so they expect the patients, hey, we're going to take your teeth out, we're going to put your implants in, and we're going to suture up the gums closed, and you're going to go home and you're going to leave and you're going to heal in a denture. The challenge to that is that patient thinks that clinic is providing the same service that I am. And I can tell you that that's very far from the truth. We are spending lots of time in the post-operative phase where we are doing surgery, attaching the implants into the bone, and then we attach a prosthesis that does not sit on the gums, but this is actually screwed into the implants. It is non-removable by the patient. It does not come in or out. This is your permanent fixed temporary implant bridge, aka teeth in a day. That is what we use for our patients to heal in. That has been the gold standard, and that is actually what most of the busiest clinics are using, is we're using these temporary implant bridges for patients to heal in.